In three, two, one. We are live. We are live. Thank you very much for being here today. My name is Monica. We are here in this special session of people helping people and successful women entrepreneurs taking the lead in the world, specifically today, of nutrition. We have Eleanor Duelley from Virginia, who is going to tell us everything about herself and what she's doing to help people with nutrition. Eleanor, thank you for being
Yeah.
here.
Thank you so much for having me this morning. This is such a great way to share and to reach other people. So I'm happy to be here.
Thank you. Thank you for being here. And so tell us what is your background? Because I know you have a master's degree,
Yeah.
and what led you to this the world of nutrition?
Yeah, well, I actually started off, I was in the military for 6 years and out of college. So I spent some time in the Navy in leadership positions. And after I got out of the Navy, I followed my husband around, who is also in the military. So we had 3 kids. So in the span of 12 years, I put my career on hold while I was keeping up with all of those things that are going on. And then I really started getting into working out and wanting to feel better after having so many kids, and just all of the pressures and the stress that go on with that. I found myself in the gym every day, and I wanted to learn more about personal training and the body. And so I got some certifications so that I could teach classes and really help people that were struggling just like me. And I worked at the local YMCA, and they offered me a position to create my own fitness boot camp. And so I thought, well, if I can add some nutrition in there, that might really help people figure all the aspects out of being healthy and living a healthier lifestyle. And I met with a little resistance because I didn't have a lot of the background and education that I needed to really launch a program that people could sink their teeth into and really follow. Um, so I went to the Institute for Integrative Nutrition for a year and got my health coaching certificate. And then I followed that with going back to grad school, and I got my master's of science in integrative nutrition. And that really just gave me the tools I need to really reach out and dig a little bit deeper with people, not only with working out, but also eating healthy and living healthy lifestyle with healthy habits, and a sustainable program that is going to keep them where they want to be, rather than being on a diet that ends and then them falling back into the same habits that they used to have.
Wow. Now, I didn't know this thing about the Navy. You didn't tell me about
Yes.
that. That's
Yeah.
amazing. So there you had the discipline also. You developed discipline, and you realized how, I think it started from there, how important it was, also nutrition and, with performance, right? I think
Well,
it
yeah,
started.
and working with people and helping them to make changes, not just, I mean, before I even thought of nutrition, but just making their lives better and figuring out what about them. You work with some people, and they work differently. They're visual learners, or they're practical learners, or they're hands-on learners. And so I really got that background of leadership and how to help people on their level, wherever they are and wherever they come from.
In different ways, because yeah, as you say, everybody learns in different ways. And then you
Yeah.
had three kids, not one, not two, three. But
Yeah.
when did you start? I mean, you look, I mean, you look like you're 25. What do you
I am
do?
not. I
Wow.
know. Well, focusing on nutrition and, really just understanding how to take care of yourself. And, I'm very disciplined about sleep, and I'm very disciplined about rest and relaxation when my body tells me that I don't need to be working out, and I need to be eating healthier foods. So, I've been able to cultivate that. Yes, I have 3 kids. My oldest is just turned 13. So,
Wow. Well, kudos
yeah,
to
and
you. You look
thank
amazing.
you.
And let's find out. Let's find out. So what area of nutrition do you specialize in?
So I work with people who have chronic inflammation. So, and sometimes that seems like a big scary word, but really, if people are struggling with digestive issues, if they're struggling to lose weight or they've plateaued in their weight loss efforts, and really, we're programmed to cut calories and to work out harder. And I've found in my personal experience and research and helping my clients that that is not the way to live a healthier lifestyle. You end up exasperating any issues that you might have. So, for example, if you feel bloated after you eat, or you feel digestive cramps, or you have achy joints, or your muscles are sore, or you're tired all the time, and you feel like pounding coffee is really the only way you can get through. Um, those are symptoms that things are not in alignment, whether it's hormonal disruption, whether it's gut imbalance, whether you could be eating healthy food, and if your body's not digesting and absorbing it properly, you're not getting the nutrients you need to live a healthy, happy, balanced life. And so I help people find the root cause of these symptoms that add up over time, and we kind of think they're normal or they're no big deal, but over time, for decades, people are starting to see that chronic disease can come out of them. You can have high cholesterol, you can have high blood sugar, and these are things that are totally treatable if you have the right tools and information.
Wow. So another thing, you think there is a link, right, between inflammation and weight?
Yeah, I absolutely do. And chronic inflammation is basically the way our body deals with having a toxic overload. And these toxins can come not only from our food, but they can come from cosmetics. They can come from the water we drink and the air we breathe. And if our body is constantly fighting to get these toxins out of our body, it prioritizes that over fat burning and revved metabolism. And so, if we can remove the part that our body is spending so much time and energy trying to get out, if we can remove that, then it allows our metabolism to rev up and to do the things it wants to do. Our body wants to be at a healthy weight. Our body wants to not be drugged down by extra fat or toxins. It wants to live and thrive. And so we have to take it upon ourselves to remove things that are keeping us from doing that.
Mm. And what type of and everything sounds amazing. Now, what type of programs do you have to help us with,
Uh,
these issues?
yeah, the most effective program that I've worked with is a 90-day one-on-one coaching program that I created and I developed because it gives me time to sit with somebody and listen to what's going on, listen to their health history, listen to where they've come from, what their parents suffered with, and how their childhood, maybe childhood illness or injury has affected where they are right now. And so I take all of the information and I connect all these dots and I create programs made for that individual. I create a meal plan that is nourishing based on the symptoms that you're having or any disorders or disease that could be affecting you. You need different things than your neighbor needs. Then your aunt or your uncle lost 20 pounds on a different diet. Your body needs something different. And so I personalize this for you. And over a 90-day period, by the end of it, you feel that you can do it on your own. You feel empowered to and confident to make the decisions that are going to encourage you to live this healthy life.
Mm.
And once you start seeing wins and you start seeing that it really works and that you're loving it, you're not going to want to turn back. So that's my most effective program.
And that's 90 days, 3 months.
Yeah,
Yeah,
right.
which makes sense.
Yeah, and that's about the amount of time that it takes for you to truly change some of the habits that you know you want to change, that you've been trying maybe on your own, or you dabble a little bit with something. But this is a strategy that it incorporates accountability. So you actually want the change and you're accountable to do it. And I feel like that's a big piece that a lot of people stumble. And then if they stumble, then they go back to what's easy,
And what
and
do
then
you
they
do?
find
You call
themselves.
them? I mean, right now, how's does the problem? You call them every day, say, ah, did you eat this? Oh, I can watch you. Oh, I can see you. Oh, what do you do to, you know, what type of
No, no. Although that might be effective in some aspects, but what I do is I do an initial consultation, which is about 60 to 90 minutes. And if you think the average doctor or practitioner can spend 4 minutes with a patient to get information. So I spend time and I ask questions, and I find out where that person, I I find out what makes them tick. I find out how I'm going to develop a program that's going to keep them accountable to it. And then we do a check-in every 2 weeks. We do a 30 to 45-minute check-in every 2 weeks. And in the meantime, I have a portal which has a chat, so you can leave messages. You have private access to me if you have a question. Or I had a client the other day say, oh my gosh, I hit a milestone. This is so hard. I don't think I can go on. And, I sat with her for 5 or 10 minutes, and it just was like, let's think about why we're doing this. Okay. You've hit roadblocks before, and then you let it wreck all of your progress. And she was able to get back on, and now she's fine. So it's there's an element of coaching, and having a coaching background as well as leadership really helps me to get people to do the things that they know they want to do. They're just struggling to get over the hump of doing it.
Wow, that's just wonderful. Yeah, well, it's and that's the way to do it because some people they just give these recipes and that's it. They're on their own.
Yeah.
But I see that you're very
And that's not
hands-on.
effective.
No,
Yeah,
and you're
yeah.
on top
Hmm.
of everyone, because it's in your you want to make them
Yeah,
do this change.
empowering them
Yeah.
to want, yeah, empower them. I can't do the work for them. And that's what I think, that's the disconnect between these quick fad diets of, I need something quick and I want it to be, I don't care if it's hard. And then you get burnt out after a couple days and you're like, this is hard. I can't live like this. Well, I want you to wake up and going, I love living like this. And I help in increments, right? We don't start, you know, on this huge healthy journey, making 1,000 changes. We make a couple that work for you, and then we grow it from there.
Now this consultation is not free. Like you have to. It's. Do you have like a special, to
I do.
offer?
So I do an initial consultation, which is just a chat on the phone to see if we're a good fit. That is free. I mean, I love to reach out and see people where they are. And if they're interested in the 90-day package, then that's when we jump into it. The 90-day package is $3.99 per month for a 3-month period. And if you pay that up front, you save a little bit on your fees and things. But I do have a payment plan. So $399 a month, and then you get 2 sessions with me every month.
I
Plus all
see.
the updated meal plans. And, along the way, if we have to adjust the protocol and adjust the plan, then that's what we do. I personalize it for each person so that I don't have something already planned out and ready to go, because every person needs something different and they need that one-on-one attention from me.
Yeah, that's and you also do like group uh special group programs, no? Once in a while. You're having one right
Yeah,
now
so
that
I
we
am
just
having one
missed,
right
but
now.
we're gonna,
Yeah, yeah.
yeah.
We just missed it. So I created a group coaching program called Tame Your Inflammation, and it's a 28-day boot camp. And I am relaunching it in the new year in January. So if that's something that interests you after the holidays, you'll be hearing more information about that coming out. But what it is I've consolidated the principles of taming your inflammation, and those are nutrition, exercise, stress, and hormone disruption. So each week you get a live training from me, a live question and answer coaching period, and then you get 4 weeks of meal plans and workouts that help you get to the point of releasing that inflammation so that you feel better. You want to work out, you want to eat healthy. We get past all those minor roadblocks that might have you've stumbled in the past, and these break you through those in a 28-day period. So it's really exciting. This was the first launch I had with this program, and it's really successful so far. And so I can't wait to relaunch and get
Yes,
get the
yes, I want
buzz
to know,
going
and I
on it.
want to, come back like with a few weeks before, so we can
Oh
promote it
yeah,
too. Yes, yes.
yeah.
Now I have a question. What do you do with 'cause some people say it's acidic coffee? Coffee increases inflammation? Yes or no?
I don't think that's a blanket statement that I would make. Perhaps in some instances, it's not effective for people because it's very acidic and it can create an environment in your stomach that might not be conducive to absorbing nutrients from food.
Mm.
But that's not the same for every person.
Exactly.
Um,
Everybody's different.
yeah, and if your stomach acid is at a great level and and it works for you, then it works for you. I know some people are having issues with caffeine in relating to hormone disruption. So that is something I look at, but every body
It's
is
different.
different.
Mm.
So when you see something out there that says, "Oh, this is the cure for this,"
Yeah.
well,
Yes.
it might not be for you in the
Of course.
situation that you're in. And that's what I do. And I look at all of the aspects that could be related. And I don't have all the answers, but I'm able to look up, you know, links between medications and side effects and even dietary lifestyles that could be affecting whatever you're dealing with.
Yeah, that's another thing. Many people have these diets and they follow these diets that they're good for one thing and then they destroy other things inside our body that
Yeah,
and you don't see it. You see it only after it's done.
yeah.
And yeah, so you look at that too. And what about alcohol? Is alcohol um does it increase inflammation or it's also another personal
It does.
ah,
That's one thing that I know for sure. And the reason is because alcohol is a toxin for your body, and your liver has to process it and get it out. Now, there's something to be said for different tolerances of people. There's some people that can't have a drop because the toxicity of it, that their body can't break it down. Okay. There's some people that it doesn't really bother that much. But one thing we do know is that it is a toxin.
mm,
There are cleaner options of alcohol out there, definitely. Um, Definitely cleaner liquors that don't have any additives like sugars and coloring. And so if you're getting a drink with the whipped cream and the chocolate drizzle and all of those things, like those are not good for your body.
mm.
Your body has to
Because
digest them. And
my grandmother, she lived until she was 99 years old, and she
yeah,
used it's from Italy, and she used to drink a little bit, but like one like can I say like this much, half an inch like that of red wine every day. And I know that red wine has antioxidants, right? So that's like
mhm.
an
Yeah,
exception
so
too, right?
sure. Yeah, absolutely. And there's definitely research out there that says a glass of wine a night or a week, promotes good,
Yeah, it's the
heart
excess,
health.
it's the quantity, it's the
It's the
and
excess. And
and
if
the
your
type.
grandmother was living in Italy, I also lived overseas. They have a lot more pure or products, because their equivalent to our Food and Drug Administration is very much strict on preservatives, where in America, there's no limits on, because alcohol belongs to the arms and tobacco, alcohol,
Mm.
tobacco and
Organization, yeah, the drug,
firearms,
yeah.
the ATF, because it belongs to that, they're not approved through the FDA. So, for example, wine, it doesn't have to go under regulation. The only thing that's regulated is the percentage of alcohol. So it doesn't account for all the additives, all the extra sugar, all the extra preservatives. Those are the things that give you headaches the next day. Those are the things that make you sick. Yes, the alcohol doesn't help, but if you're drinking a much cleaner product, I actually am a member of a wine group that does double independent testing of sulfites, and it comes from organic grapes, and it comes from cleaner sources. So you may have a glass, and the alcohol isn't what's overpowering for you. You're actually getting the nutrition from the antioxidants, and you're enjoying a glass of wine without the
Exactly.
headache.
So always read your labels and know where everything comes from. And wow, Eleanor, well, it's I could listen to you forever. We're going to
Yeah.
but very interesting. You're so knowledgeable, and I hope that people, out there who are thinking, at least do a consultation, an online consultation, and
Yeah,
um
it's
and
totally
then
free. You can just find me on Facebook. You can message me. And we just have a chat just like this. And, we see what is a fit for you, what is actually going to work. I mean, and there are people that it's not a fit for, and that's okay. So, it's about getting you healthy and where you want to be. And if you truly need help and guidance, then this is a great opportunity.
you're going to get the right one-on-one
Yeah.
experience that many of us, that's what we need, because all these group things, yes, they look very fancy and very, but then at the end you go back and you go back to your own habits. So
Yeah.
this is the best option, I think. Eleanor, thank you for being here. I really want to know more about your next programs, and how you develop. And thank you so much for coming here and sharing your knowledge, and helping people have a
Yeah, you're
better
welcome. Thank you
have
for the opportunity. Yeah.
yes. And we'll see you soon. Okay.
Yes, yes. Thank you. Bye,
So
guys.
yes, thank
Find
you
me
very
on
much,
Facebook.
and I'll see you very soon. Good luck with all your endeavors.
Okay, thank you.